So we have our final speaker today is Dr. Heather Kennedy from the Kansas City Pet Project, and she's going to talk about caring for feline leukemia-positive cats in the shelter or rescue. In her current role as Director of Feline Operations at Kansas City Pet Project in Kansas City, Dr. Kennedy covers all aspects of feline operations, including animal care, health and enrichment, behavior, and feline fostering. She began her career helping cats as a trapper, colony caregiver, and foster caregiver before attending UC Davis School of Veterinary Medicine, where her singular commitment to cats earned her numerous scholarships, as well as the AAFP Outstanding Scholar Award. In 2017, after 4 years in feline-only private practice, Dr. Kennedy decided to focus instead on the welfare of shelter cats. Recognized as an expert on the humane care of feral cats, Dr. Kennedy currently sits on the AAFP's Committee on Free-Roaming Cats and speaks at national conferences on her work in sheltering. Dr. Kennedy, I would like to welcome you to the Feline Leukemia Day. And it looks like your slides are up and your microphone is on, so take it away.
Thank you very much. I'm excited to be here today. It's a really busy day at the shelter today, so it's nice to take this little break and talk to everyone about feline leukemia cats. I think we're adopting a couple out right now, actually. So I apologize in advance for the fact that I don't have cute kitten photographs in my presentation. I'm the type of person that likes to always have all of the words I need later on. So I'm providing you with my words on my slides, and feel free, if I don't, feel free to ask questions at the end, and also contact me by email later if I don't explain something to your satisfaction. Okay. I'm going to borrow the name FeLVs. I like that a lot, and it's easier than saying feline leukemia kitties all the time. So we're going to talk about keeping FeLVs healthy while they're in your care. And then the very best way you can keep them healthy is to get them out of your care and into adoptive homes as quickly as possible. I think that several of the speakers have talked about that during the day. So I'm going to focus on how to keep FeLVs healthy while they're in your care in either a shelter or a rescue. So let's start with arrival in the shelter. So when they arrive in the shelter, you may not know, or rescue, you may not know that you have a feline leukemia positive cat. And so if at all possible, an examination by a veterinarian is standard of care, because we want to look for subtle signs that lay people might miss, like large lymph nodes. If you're not used to filling lymph nodes all the time, you might miss that there's a large one. An abnormal breathing pattern. This can happen later in the course of feline leukemia virus disease, when kitties may develop something called mediastinal lymphoma, cancer of the chest cavity. And so it can I shouldn't say early in the disease process, but it can cause very subtle changes to the breathing pattern, which become more pronounced as the cancer grows. So that's something else that you would want to look for. You'd want to look for large kidneys because of the fact that renal lymphoma is a common outcome of feline leukemia virus. And then I'm going to skip over that porta body condition for a second and talk about abnormal abdominal palpation. So the reason that we want to fill the abdomen is that feline leukemia can cause a few different things to go wrong in the abdomen. It is sometimes associated with GI lymphoma, but I presume everybody on this call has had cats before and dealt with cats for a long time, and you probably know that GI lymphoma is very common in cats without leukemia virus as well. So when we're doing an abdominal palpation, we're feeling for abnormal intestines or abnormal GI lymph nodes that may give indication of lymphoma, but that's not necessarily going to be related even to the feline leukemia virus if a cat's positive. It's just something to look out for. Indeed, kitties with feline leukemia virus that develop GI lymphoma, the GI lymphoma can often be managed or treated successfully with chemotherapy, regardless of FeLV status. And now let's get to poor body condition. So in any kitty, in my opinion, the very best indicator that there's a problem with their health is that they have lost weight or they have a poor body condition. And one of the things that we're looking for in FeLVs is, are they eating and what is their body condition? So this is something that any layperson should be able to take a look at a kitty and see how tucked in the abdomen is. Are the ribs very prominent? Is there muscling? Is there good muscling over the legs and thighs, or do they appear skinny? So even if you don't have a veterinarian on staff who's doing your intake exams, a poor body condition would be a sign to you that it's time to seek the intervention of a veterinarian in an FeLV positive kitty. Again, so on arrival, we're going to be assuming that we know a kitty's FeLV status. We're going to be looking for these as clues to their current health status as a FeLV. But these are things that if we don't know leukemia virus status, these are going to be things to look for that will tell us we should test if we haven't already. Also on arrival, two common problems in FeLVs are that they develop oral cavity disease. I'm concerned more about stomatitis than periodontal disease. And that's a really important distinction for me because stomatitis itself can have a poor outcome for any kitty, whereas periodontal disease can easily be treated with routine dentistry. So stomatitis is defined as generalized inflammation of the oral cavity. It's believed to be caused by an immune system overreaction to bacteria on the teeth, but that's an area of ongoing study as well. The problem with stomatitis is it causes really painful oral inflammation that can be cured about 70% of the time by full mouth extractions, but 30% of those cases are not cured and either require ongoing medical management, or you may not be able to, in about 15% of cases, you may not be able to help the kitty at all. So on that initial examination, take a really good look at the oral cavity. If there's periodontal disease, treatable and not a poor prognosis. If there's stomatitis, then already there's a difficult prognosis and something you may not be able to treat in a shelter or rescue depending on your resources. And you also want to consider quality of life of the kitty. If you're not going to be able to treat stomatitis and there's going to be severe inflammation of the oral cavity that causes the cat to be so painful that it can't even eat, then not a good quality of life for the kitty. So then if you see evidence of stomatitis, and the cardinal sign is something called caudal mucositis, where the very back of the palate is inflamed. If you see that, and you know the kitty is a FeLV, then that's something to consider again, whether you have the resources to treat and provide a good quality of life. So on intake, we're going to do our best to get a good physical exam, learn as much as we can about the health status of the kitty from physical exam. And again, if you don't have a doctor helping you out, if you see any problems, it's time to seek the care of a veterinarian, a private veterinarian if necessary. The other thing to do on arrival, and this is somewhat controversial, is to vaccinate against panleukopenia with a modified live vaccine. So the 2006 AAFP consensus guidelines on vaccination actually stated that the recommendation is for a retrovirus positive kitty, whether that be an LV or an FIV positive kitty, that they be vaccinated with a killed virus vaccine. And I'm going to disagree with that in the shelter scenario or rescue. And the reason for that is that a modified live vaccine confers some protection against panleukopenia immediately on vaccination unless there's interference from maternal antibody. And I suppose we could know if there's interference from maternal antibody if we were doing antibody titer testing, but we aren't doing that. So we can't know whether or not there's interference from maternal antibody when we vaccinate. So what we should be doing is picking the very best vaccine we can give that's most likely to protect a kitty against panleukopenia, because that's the scariest thing they're going to come in contact with possibly while they're in the care of a shelter or rescue. So a killed vaccine, on the other hand, isn't going to confer any protection immediately. It's going to require a second booster vaccine 2 to 4 weeks later to confer protection. So that's a really big window during which a kitty could become exposed to panleukopenia. And that's the thing that we're most worried about. So I would say at admission to your shelter or rescue, vaccinate against panleukopenia with a modified live vaccine. The modified live vaccine needs to be given again in 2 to 4 weeks so if this is a kitten that we're talking about, sorry. So if it's a kitten under 20 weeks of age that may have maternal antibody interference, you're going to vaccinate again in 2 to 4 weeks and every 2 to 4 weeks thereafter until they are at least 20 weeks of age, because that's when we know there should be no more maternal antibody to interfere with vaccination. If they're an adult kitty or a kitty over 5 months of age that should not have any maternal antibody interference, then we're just going to revaccinate again in 2 to 4 weeks just to make sure. That's not a booster. That first vaccine should have been effective and probably fully protective. That second vaccine is just to make sure that in case there was something preventing that first vaccine from working, in case that kitty was immune compromised in some way on intake that prevented them from responding fully to the vaccine, we're going to vaccinate them one more time. And here's something really important that I have found to be overlooked quite often: vaccine storage. Vaccines have to be kept under refrigeration. You should read the label on the vaccines you're using. The ones that I'm using specify 35 to 45 degrees Fahrenheit until ready to use. So we really want to make sure that the vaccine that we're using to protect this kitty that's already got an immune compromise, we want to make sure it's the very best vaccine we can give. And a vaccine that's warmed up is not a good vaccine. So you should be keeping your vaccines in a refrigerator that stays between 35 and 45 degrees Fahrenheit until you're ready to use them. And if there's a time when your refrigerator loses power and you aren't aware of how long the vaccines have been warm, get rid of those vaccines and start over with a new flap. I actually recommend a separate thermometer and alarm for your vaccine refrigerator. It can be as simple as one of these from Amazon. This is what we have in our vaccine refrigerator. It doesn't have an alarm, but it does show me right up here. So each morning I can check and see the maximum temperature that the refrigerator has reached, and then the minimum it's gotten to. And so and we actually are having problems with our vaccine fridge right now, and it has sometimes gotten all the way up to 53 degrees. So you want to make really sure that any vaccines you're using on any kitty, but especially an immune compromised kitty, like a FeLV that needs all the help they can get, that they're getting the best vaccine possible that's kept at the right temperature. And regarding drawing up vaccines, modified live vaccines, if you aren't used to using them, they have to be mixed. You get a powder and you get something called a diluent that you mix the powder into. That should be done immediately before vaccination, and different virologists disagree on how long a vaccine can be mixed and still be good. And so the most conservative recommendation I've heard is use it immediately, and that's not always reasonable for us, because if we're intaking a litter of kittens, then we're typically drawing up vaccine for those kittens all at once. So I go within 1 hour. If the vaccine was mixed more than 1 hour prior, I discard the vaccine and get a different one. Okay. Also on arrival, we're going to treat for parasites. So both ectoparasites like fleas or ear mites, and endoparasites. So Revolution Plus, and Advantage Multi are my top choices. And that's because they get the things that I'm most concerned about. And to be quite honest, the thing that I'm most concerned about is roundworms. So roundworms are the intestinal parasites that look like spaghetti if you are lucky enough to see them when they're vomited or pooped out. And these roundworms, they actually have zoonotic potential, meaning that roundworms can cause disease in humans. So those are the ones that I'm most concerned about. They can also cause weight loss in cats. They are kind of some bad agents. So Revolution Plus, and Advantage Multi all get rid of roundworms. And then the second thing I'm very concerned about in FeLVs is fleas, because FeLVs are more inclined to develop anemia anyway. So I definitely don't want a blood-sucking ectoparasite hanging out on our FeLVs. So other agents that these particular or other parasites that these particular agents treat are hookworms, again, ear mites, heartworm, and then Revolution Plus, and I believe Advantage Multi, but I'd have to check, also do ticks. And I'm sure that's the case with Revolution Plus, because I'm used to using the Revolution products. I'm less sure about Advantage Multi. Ticks should be something you're not too concerned about with FeLVs, because these kitties should be staying inside. But if on intake you note ticks, then it's time to put on something that will kill those ticks, kill any ticks that you can't see that are too small for you to see, and pull off the ones that you do see. Again, we're really worried about anemia in FeLVs. Another part of the intake on FeLVs, if at all possible, if finances allow, if you have the ability to do it, then draw some blood to do a complete blood count and serum chemistry. Or if you can't do both, my preference in a FeLV would be a complete blood count. Even cheaper than that would be you get a drop of blood, put it on a smear, and you learn how to do a complete blood count from a blood smear. That's certainly something that lay people can learn to do. And so one of the things we're looking for when we do this complete blood count or PCV or blood smear is we're looking for anemia. Again, FeLVs often develop anemia or low red blood cell count. And there are many mechanisms by which this happens, actually. So there's not one particular cause of anemia in FeLVs. There are several different potential causes, including bone marrow suppression or including an aplastic anemia. But there's one really treatable cause of anemia that happens in cats in general, but FeLVs may be more predisposed, and that's Mycoplasma haemophilus. So that's a parasitic bacterium thought to be carried by fleas that attack the red blood cells and cause the red blood cells to die, and that causes anemia on its own. And so this is a treatable cause of anemia. It's treated with a 2-week course of an antibiotic, either doxycycline or preferably a more expensive name brand, Veriflox, which is the name brand for pratofloxacin. And so a 2-week course has been shown to reduce anemia with doxycycline. Veriflox can actually get rid of more of the infectious agent or result in complete cure, whereas doxycycline may only suppress the infectious agent. Either way, both of those should resolve the anemia after about a 2-week period. You don't want to treat without a diagnosis. So one of the things we're concerned about in veterinary medicine in general is antibiotic resistance. We shouldn't really use antibiotics unless they're really needed. And so one concern would be, should we be using Veriflox as a fluoroquinolone? And that's what we call one of our big gun antibiotics. The fluoroquinolones are a big gun antibiotic. And so we really don't want antibiotic resistance to build up to the fluoroquinolones. So what we should do before we treat is we should do a blood test to verify that there is Mycoplasma haemophilus. Now, Mycoplasma haemophilus can be sometimes diagnosed by some brilliant people by looking at a blood smear. I've never been able to do so. We have one technician here who seems to be good at it, but you can get false negatives if you try to diagnose that way. So the best thing to do is to send blood into a commercial lab like IDEX, where they can do PCR to look for particles in the blood. A good thing to know is there's no need to recheck the PCR at the end of treatment. We're just looking for the anemia to resolve. So the blood test, if you use IDEX as an outside lab, if you happen to have access to it in your shelter, this is the test you want to run, the 1717. They require whole blood in an EDTA tube, that's the lavender top tube, and the list price is $58.09. Now, if you're using a private practice veterinarian, if you're at a rescue and you're using a private practice veterinarian, they're going to mark that up, as they should, because there's staff time required to draw the blood. There's time required to write a record, to give you the information, to prescribe the drug. So $58.09 is the cost. So it may be considerably more than that, depending on who's running the test for you. Is it your own shelter, or is it a private practice vet? Just remember that they have overhead to worry about, so it's completely reasonable to mark that up. Now, another thing that you should know, again, as I stated on the previous slide, you don't have to repeat the test. So we'd really like to do the test once to get a diagnosis before we start treating with a big gun antibiotic and risk antibiotic resistance. But you don't then have to test again to see if the organism's cleared. You just want to make sure that the anemia resolves. And so that can be, again, as simple as a PCV test, which should be pretty cheap. Okay, so that was all the things that we could or should, let's not say should, those are all the things that we would like to do at intake, and those are the things that we would do in the best of all possible worlds. Now let's talk about how we're going to, after intake, house and feed these kitties. So when I first arrived at KC Pet Project, the kitties, the FeLVs, were housed in a separate room without a window. It was kind of a depressing little room, and that's it. They were housed in a separate room with a big sign on the door that they were FeLV-positive kitties in the room. They did great adoptions. So regardless of the fact that it was in kind of a dark room away from the other kitties, they did a great job of adopting those kitties out. But they didn't really need to be kept in there. And we ran into the problem of, so what happens when you have one more FeLV than you have space in this room for? And we hadn't yet really expanded our foster program like Austin Pets Alive has. So we didn't have all of these foster families that we could rely on to foster FeLVs when we had too many. So then we decided, okay, well, They don't really need to be separated in this special room. Let's move them out into the general population so their kennels will be amongst all of the other kitties. Now, I was new to Kansas City Pet Project last summer, and so getting my team to think that it was okay to commingle the FeLVs separated by kennels, but with the general population, that was a big hurdle for them to overcome. And then I found out that they were always putting the FeLVs in the bottom kennels because they were concerned, what if FeLVs were in the top kennels and something fell out of the cage, like a bit of food or a bit of litter? Would that be infectious to the kitties below? And then I went into one of our satellite facilities and I found the FeLV kennels were padlocked and required a key to open them, and had big signs saying wear gloves, all in caps. So it's difficult sometimes to get people to believe you when you say this disease doesn't transmit easily. Sustained close contact is required through saliva typically, so shared grooming, shared food and water bowls, and that it's not like ringworm spores that might float through the environment. These kitties, as long as they're separated by a kennel, they're not going to transmit their virus to the other kitties around them. And so this goes along with also de-escalating. We want to de-escalate feline leukemia virus. We want to de-escalate concerns about it. It's a virus that can be transferred to other kitties through sustained close contact, and it's a virus that may well result in a limited lifespan for a kitty, but that's it. It's not some terrible thing that we should be scared of and that we should make other people scared of. It should be really just as simple as what I just said, those two key points. So the FeLVs don't need to be separated from the general population as long as you're using kennels. They don't need to be in bottom kennels only, and they don't need to be locked up. People can certainly, if you're at a shelter where people are already allowed to reach into kennels and pet cats, they should be able to do that with the FeLVs as well. Feline leukemia virus is what we call an enveloped virus, so it's very easy to clean. It's easy to wash your hands. Even hand sanitizer can get rid of feline leukemia virus on a hand. But again, if the cat's not licking your hand, it's probably not something you're picking up very much of when you just interact with them on a normal basis just by petting. So let's de-escalate the concerns about feline leukemia virus by integrating these kitties into the general population if possible. And I really like Monica's idea that they don't even really mark the cages clearly to tell people, hey, this kitty has feline leukemia virus. We do that here because otherwise, frankly, we'd forget who they are, because it's something that we just commonly deal with here, and we're not at ThreatCon Red. So we do mark our kennels to some degree, but it's not stop sign language. It's our marketing department came up with really adorable little cards that say, absolutely positive, I have leukemia virus, ask more about me. So no need to separate, no need to have them in any special place, no need to prevent the public from handling them, just routine precautions such as hand washing are fine. If you happen to allow free roaming, so the last shelter that I was at was all colony rooms and there were really no cages. So then we did separate out feline leukemia virus positive kitties from those without feline leukemia virus. And we did test kitties that went into colony rooms. We had stopped testing in general, but for kitties that were in colony rooms, we did test and segregate. So considerations for colony rooms, we want to, again, keep these kitties healthy. And so if you're in a shelter with colony rooms, I'm going to recommend you go to the UC Davis Correct Shelter Medicine Program website and read up on their information sheet about housing considerations. This is just a good document in general, but they have some really good guidelines specifically on colony housing. So if you happen to be lucky enough to have some colony rooms for your kitties, they're recommending at least 18 square feet of floor space per cat, so that they can maintain a distance of 1 to 3 meters between themselves and any other cats. So just because you have a big room doesn't mean now you can cram in more kitties, and especially FeLVs. We want to do whatever we can to keep them healthy while they're in the shelter, and that means allowing them sufficient space to decrease their stress so they can feel as though they have some control over their own environment. A group size is recommended of 2 to 4 cats. So regardless of the size of the room, they're going to recommend that you don't have more than 2 to 4 cats in a room. And anyone who's put a large group of cats that are unknown to each other into a room can guess why that might be a recommendation. It can be really, really stressful for unknown kitties to suddenly be forced together. I don't know if anyone ever watched the show Big Brother, but I presume it's something like that. Just throw a bunch of people into an apartment and you have a similar outcome. All of a sudden, there's aggression and stress. So at maximum, no more than 8 to 10 cats per adequately sized group room. So regardless of how big your room is, try to stick with 2 to 4 cats, but never exceed 10. We also want to make sure that we're feeding these kitties a consistent diet and weighing them weekly. So what is an appropriate diet for a FeLV? I hesitate even to go over this slide because people are very set in their ideas about diets. The one thing I would say, no raw food. So FeLVs should not get a raw diet because of the increased risk of salmonella or E. coli from raw food products. And again, we've got an immune compromised little friend to take care of, and we want to make sure we're doing our best for them. So that includes not risking giving them salmonella or E. coli. So we have 2 different Purina diets on this slide, and both are nutritionally complete. There's the reason that one might choose this nice Purina Veterinary Diet EN over Cat Chow Complete. Both are all life stages, by the way, so good for kittens and adults, which makes me happy. But the reason to choose a more expensive diet is not because there's anything premium or high quality. It's a more digestible protein source typically. So a higher quality protein source typically. But the Purina Cat Chow Complete, if that's what you can afford, that's a fine diet for your shelter. It's going to result in more fecal output probably than the Purina EN because of the proteins involved, but it's a nutritionally complete diet. It's formulated for all life stages. It's inexpensive, and it's from a company that hires board certified veterinary nutritionists to formulate their diets. So for my money, if I'm strapped for cash, I'm going to reach for that Purina Cat Chow Complete, and I'm going to feed that all the time. So the most important thing is choose a diet from a manufacturer that has boarded veterinary nutritionists formulating their diets, Make sure you've chosen a food that's appropriate for the life stage that you're feeding, whether kitten or adult. And again, I like the Cat Chow Complete because it's all life stages. And then feed that same thing all the time. Unless you have a cat, unless your FeLV decides that it's not going to eat the same diet anymore, the best thing you can do to maintain GI health is to feed a consistent diet. They aren't like us. They don't need to have a different type of food every night. They don't necessarily, actually, I guess I don't either. I could eat from a taco truck pretty much every night of my life. So they don't need variety like we crave as humans. What they do best with is a very consistent diet. And again, major companies that have board certified veterinary nutritionists formulating their diets include Purina, Hills, Royal Canin. So choose from a company that's doing a really good job of making sure their diets are nutritionally complete. I'm gonna say that I feed Purina Cat Chow at my house. So the next thing to do is to weigh cats weekly. So there's really nothing more important in cat health than making sure they maintain their weight. Even your fattest cat is not going to give in to peer pressure and decide to diet. So they don't have body image problems. If they are losing weight, there is a health problem. And with FeLVs especially, I think Monica mentioned this as well, we are looking for evidence of anorexia, evidence that they aren't eating. And the best way to get that evidence, because cats are grazers, so you're never gonna see them, well, some cats eat more like dogs and will eat an entire meal, but most cats like to graze throughout the day. And so you're going to miss whether or not they're eating well, unless you keep track of their weights. I can tell you from personal experience, and I do believe there's research on this that has a similar conclusion, but from personal experience, most cats, after they enter a shelter, lose about a pound in the first week. This isn't kittens, of course, this is grown adults. So there's normally some weight loss associated with just the stress of moving into the shelter, the stress of a change of food. But beyond that first week, we'd expect that cats are able to maintain their weights. And if they're not maintaining weight, then there's a problem. And then that's when we have to say, okay, we need to try a different food, get the cat checked out by a vet to see what else might be going on. But weighing cats weekly, in my opinion, is the most important thing that anyone at a shelter or rescue can do to verify that cats are doing well. Now let's talk about monitoring for illness. So we've done a good intake procedure. Our kitties are vaccinated and protected against panleukopenia. We've got them housed appropriately. We're feeding them a consistent diet. Now, what are we going to watch for? So weight loss, I've said it again. I've had it on 2 slides. That's how important it is. Even in your foster homes, I'd recommend they have baby scales. Tell your adopters to buy baby scales to keep track of their kitties' weights. Again, that merited 2 slides, and I did that intentionally because to me, that's the most important thing. Okay, so we've got an upper respiratory infection now. Because of course we were bound to have an upper respiratory infection. We're a cat and we got stressed out when we moved. So when kitties get stressed out, let's just assume, we can safely assume, based on research done at PAWS Chicago, that most kitties are carrying around feline herpes virus in their body all the time. It's residing in the trigeminal nerve and just waiting to come out and wreak havoc as soon as there's stress. So humans with herpes virus get stressed out and they get a cold sore. Kitties with herpes virus get stressed out and they get kitty colds, sneezing, eye discharge, nasal discharge. And again, that's just common with stress. And so the viral discharge is normally clear. So in most kitties, other than FeLVs, we would just monitor and see how they do. Do they get over it on their own? And most should get over it on their own within a week. In FeLVs, in the general population as well, but in FeLVs especially, we might consider using famciclovir, an antiviral. And if we do that, we're going to give it at 90 mg per kg every 12 hours until resolution of symptoms, or whatever your vet says. To be quite honest, I typically do it till resolution of symptoms. Other vets will do it for a certain number of days, or certain number of days past resolution of symptoms. But the important thing to note is that research has shown, and there's ongoing research through the Orphan Kitten Project at UC Davis, using famciclovir at 90 mg per kg every 12 hours. That seems to be the dose that works the best. I can tell you from personal experience that the compounded solution, so if you get it through a company that compounds it into an oral suspension or solution, they taste terrible. Famciclovir tastes terrible. If anybody, when we do the question and answer, if anybody has found a famciclovir compounded version that tastes good, please let us know. The tablets that are formulated for humans are quite large, but I just cut them into bits, put them into capsules, coat the capsules in butter, and pill the kitty that way. So that's when I use famciclovir. That's what I do. Even with FeLVs, my choice is still to wait and see what happens with the discharge. So again, viral discharge is typically going to be clear discharge, and even FeLVs, if left alone, may get that herpes under control on their own. But then some FeLVs, or cats in general, will have a secondary bacterial infection. So if the viral infection, if the viral cold signs are not treated, sometimes they'll develop a secondary bacterial infection because there's nothing the respiratory tract likes more than, you know, a barrier, a defense barrier that's been broken down by virus, and now a bacteria is going to move in and take advantage of what's going on. And so when that happens, you're going to see a change of the color of discharge to green or yellow. The green or yellow discharge specifically tells you that there's a type of white blood cell called neutrophils that have come in to help out with the infection. And neutrophils only come in to help out when there's a bacteria present. So when you see that green or yellow discharge, neutrophils are present, which means bacteria are present. And so that's the time to use an antibiotic. And to be honest, in non-FeLVs, even if there's evidence of bacterial infection, sometimes I'll just wait and see, because cats sometimes, a healthy cat sometimes can clear that on its own as well. However, if it's a FeLV or a cat with immune compromise of any type, I'm going to start antibiotics right away. And so my preference is just to use systemic antibiotics. So they may have eye discharge, they may have nasal discharge, they may have congestion. Even if they only have eye discharge, a lot of times I'll reach for doxycycline and dose it at 10 mg per kg once a day. And doxycycline works because it's an antibiotic that is actually shed in tears. So even if only the eyes are infected, then the doxycycline that you give by mouth is going to help with that. So it also happens to work on common bacterial agents that we find in kitties. So mycoplasma is a good example. So doxycycline can be given once a day. So some vets will say to give 5 mg per kg twice a day. It works just as well to give 10 mg per kg once a day. So I like it because I'm trying to reduce stress for these kitties, and sticking any kind of medication into their mouth is a stressor. So once a day dosing is perfect. And then again, there are compounded suspensions. So you may use a compounding pharmacy that sends you doxycycline that has a 6-month expiration date. Unfortunately, you can't really trust that expiration date. Dr. Papich out at North Carolina did a study on compounded doxycycline and found that it's really only stable for a maximum of 2 weeks, and he recommends use within 7 days just to be very safe. So rather than having a compounding pharmacy compound your doxycycline, my recommendation would be compound it yourself. So you can get doxycycline capsules. You can empty those into, and Correct Shelter Vet website also has some instructions on this, I believe. You can empty those capsules into chicken broth or whatever agent you like, into a small bottle, Yorker bottle, shake it up, keep it in the refrigerator, and that becomes your own compounded suspension to use within 7 days. Clearly, you're going to be doing this only if you have a veterinarian who's helping you with it. Another option would be if you don't have a veterinarian on staff and you really need to have someone call in a prescription for you. If you're getting compounded medication, then I'm going to recommend you use a pill. The problem with tablets, so I do like compounded doxycycline tablets from Wedgwood. They're very tiny. The problem with any tablet, doxycycline tablets can cause painful esophageal strictures in cats. It happens in humans as well, and I have a friend who had a esophageal stricture from doxycycline, and she assures me it was quite painful and lasted for months. So if you're giving doxycycline in a form other than suspension or solution, so other than a liquid, you're going to want to only use it in a cat that's eating, because you're going to want to give the medication right before they eat. So when they eat, they're pushing that tablet through the esophagus. The other option would be to use a capsule, so put the tablet into a capsule so it slides down the esophagus really easily. Again, I still think it's best to have the cat eat right after that, because we don't want the capsule melting in the esophagus and causing stricture. It's also fine to just use topical eye ointment or drops if only the eyes are involved, but ointment can be irritating on its own. I prefer doxycycline. Another thing to watch for is vomiting and diarrhea. I'm here to tell you, as a cat doctor that worked in private practice near Los Angeles and in Sacramento, so major cities, seeing many, many cats, vomiting is never normal. I don't care how many cats are vomiting, it's not normal. And why would we think any species should vomit as a normal course of the day? So vomit's not normal. If you see it, we can't always figure out what the cause is, and it doesn't always mean the cat's terribly sick, but it's not normal. So if there is vomiting, it's not normal, please see a vet and have it worked up. In FeLVs, what we're worried about with vomiting is have they developed some sort of generalized disease secondary to their feline leukemia status, such as lymphoma. Any type of cancer can cause vomiting. Any type of cancer can also cause anorexia, but vomiting is another potential problem. Diarrhea is never normal either, but it's more common in general. So diarrhea is typically not a sign of terrible things happening in the GI tract. It's typically a sign of some sort of inflammation, and it could be something as simple as feeding a diet that's varied. So stick with a consistent diet. If there's diarrhea, follow up on it. If there's vomiting, follow up right away. And then again, watch for decreased appetite. There's something called cancer cachexia, where kitties lose weight and eat less. Always watch for decreased appetite as your canary in the coal mine, that there's something going on with the cat that shouldn't be happening. Watch for lethargy. Again, just because a kitty has feline leukemia virus doesn't mean it shouldn't be playful and interactive, and lethargy is a sign that there's a problem and you should follow up with a veterinarian. I'm not sure if this is, I don't think I've stated this yet, but kitties with feline leukemia virus are 62 times more likely to get cancer. 62 times more likely to get cancer. And the cancers that they most commonly get are leukemia, so cancers of the white blood cells, and lymphoma, GI lymphoma not being one that's typically seen with feline leukemia virus again, but some type of lymphoma. So we're going to be watching for lethargy, decreased appetite, vomiting, because we're really watching for cancer in these kitties. Lumps and bumps, again, we're watching for cancer. Lumps and bumps under the skin can also be big lymph nodes. And sometimes kitties with feline leukemia virus will get big lymph nodes just as a result of them having active lymph nodes because their body's trying to fight something off. But it can also be a sign of generalized lymphoma. And so anytime there are any kinds of lumps or bumps, get those checked out by a vet right away so they can be diagnosed as either reactive lymph nodes or cancerous masses. And again, most importantly, get them into homes as quickly as possible so that a family that loves them can take over care. It's much better for them to have the individualized attention that a family can provide. As much as we love them, we can't give them the individual attention that they need and deserve. And now we're at the point where I'm ready to take any questions if there are any.
Dr. Kennedy, thank you so much. And we have just a few minutes left for questions. Somebody was asking for more details on the homemade doxy suspension.
Yeah, So doxycycline can be compounded, and I first found this out actually prior to vet school when I was reading something put out by the CDC. They recommended, like, keep doxycycline on hand in case it's the end of the world and you need an antibiotic, and then here's what you do with it. And so you actually can compound it yourself if you have doxycycline capsules that are full of doxycycline powder. Then you pour that powder into some sort of agent that a cat might like to ingest. So chicken broth is one. And again, I think that Dr. Hurley on the Correct Shelter Vet website has some ideas for different ways to compound doxycycline. So chicken broth is what I typically use. Sometimes I even use water. And then you're going to want to compound it to a degree that it's a pretty, that you've really mixed the medication with whatever you're suspending it in really well so that there's less medicinal taste for the kitty. Again, you'd want to do this under the guidance of a veterinarian.
And are you feeding your cats wet and dry food there?
We are. Yeah.
Okay. This wasn't brought up during the conversation, but somebody is interested in sort of asking your thoughts with regards to FIP and the prevalence of it, like with spay neuter. What's the timing of spay neuter that you do, and are you seeing any FIP in there too?
Okay, who's looked me up and knows that I am into FIP? Okay, so FIP, so that's an interesting one. Certainly when we are dealing with kittens that we know have massive quantities of coronavirus in their system, and we know that coronavirus can mutate, and we know that any stressor can help lead to mutation, we want to minimize stressors. And so early spay neuter for sure can be one of those stressors. But I'm a big proponent of early spay neuter, and as early as 6 weeks. In California, we did it at 1.5 pounds. So, and I have not seen increased risk of FIP from spaying and neutering those tiny little kittens. When I see FIP, a lot of times I'm able to trace it back to a kitty that wasn't well socialized to begin with, and we kind of force socialized. So I'm a proponent of not trying to force socialize kitties that are a little bit older, that are past the age of that are past the sensitive age of socialization to humans, just because I think that's a big stressor that I've seen lead to FIP. But spay neuter itself, I have not. I would say that one of the things that happens with spay neuter is we tend to use an NSAID. We tend to use like meloxicam for analgesia for kittens that are spayed and neutered. We'll just give a single dose. And Niels Peterson, who is a preeminent FIP researcher, is very concerned about that possibly predisposing to FIP because of the effects of that anti-inflammatory drug on the immune system. And so a recommendation that I put in place in my last shelter, it's not something that we're doing here yet, is that rather than using an NSAID for pain in those kittens, we use buprenorphine.
Gotcha. Just for the person out there, there's one question out there that it would take us like an hour to answer. And it's around the topic of when to make the decision on euthanizing and how to make that choice. And I feel like in 3 minutes, we just can't do that topic justice, but I have it noted here in the notes. And maybe that might be a conversation for us to have in the Facebook group.
I'm actually going to give you a 10-second answer.
Oh, okay, go ahead.
So my answer is the kitty suffering right now? And is there the potential for us to alleviate that suffering? If we can't alleviate suffering, I think it's time to euthanize. And if we are able to alleviate suffering, then we go from there.
What's your cutoff for socializing feral kittens?
I knew that was going to come up. So I'm kind of hardcore. So behavior science tells us 2 to 7 weeks is the socialization period for kittens. And so beyond 7 weeks, I'm getting really nervous and I'm sending kittens only to my very best socializers. But for sure, if they're 12 weeks, I'm TNRing them.
Gotcha.
7 to 12 weeks is difficult.
All right, and then I think that there's questions about square footage of multi-cats in like group housing. Is that different? Would you have that square footage requirement different for feline leukemia positive cats versus a negative colony room, or that would be the same?
Yeah, it would be the same. And that's kind of the amazing thing. Really taking care of FeLVs is the same things we should be doing to take care of everyone. We just need to be a little more alert about problems.
Okay. And it sounded like you referred to UC Davis website as a resource, as a go-to resource for you. You use that quite a bit.
The correct shelter medicine website is excellent. The Wisconsin website, the University of Wisconsin website, also excellent. So both of those shelter medicine departments have really done a good job with their websites to provide lots of resources to shelters and rescues on pretty much everything.
Fantastic. Well, Dr. Kennedy, I want to thank you so much for spending an hour with us on your Saturday, your very busy Saturday there at the shelter. I appreciate you taking the time to join us, and congratulations. I believe you have a relatively new, beautiful facility there. Is that correct?
Yes, we just moved in on January 1st. It's amazing.
Excellent. And you have a nice space for feline leukemia positive kitties?
Well, so Margaret Tompkins did indeed donate money to give us a very nice space for feline leukemia positive kitties, but we're so progressive now and they don't last here long, like they move out to homes really quickly, that we converted that space into a fungal jungle after the Austin Pets Alive model so that we can get our ringworm kitties out of the back of the shelter and into the front, and we're adopting them out now like hotcakes as well.
Excellent, excellent. So, so then you don't have the volume of feline leukemia positive kitties that you need in the shelter. You have them sprinkled around with the other cats?
They're sprinkled around. They're at our satellite. They're in foster homes, but they get adopted really quickly.
Excellent. Fantastic news. Great. Well, thank you so much again for sharing. I appreciate it. We've had this incredible day. I mean, my mind is kind of bursting with thoughts.